There are also efforts underway on a national level. A congressman from Pennsylvania has a plan to make some sweeping changes. Tim Murphy told me that we're just not doing enough to help the 60 million Americans dealing with mental illness.
There was no beds. There was no beds for his son. Was in the middle of a mental health crisis. We heard
after Virginia State Senator Creed Deeds was stabbed by his own son, who'd been turned away from a hospital for lack of a psychiatric bed. Pennsylvania Congressman Tim Murphy knew something had to change.
Our nation is in denial that such people exist. And they either want to lock them up or let them commit a crime and go to jail or let them be homeless.
So Congressman Murphy, also known as Dr. Murphy, he's the only psychologist in Congress, started holding hearings to investigate the state of mental health in our country.
There's good people out there who can do good things, and there's patients in need. But these were not connecting, and we found a number of federal barriers that was getting in the way.
Those barriers include strict medical privacy laws that make it tough for doctors and families to share vital patient information. Bed shortages at inpatient psychiatric hospitals. Murphy found that there are fewer than 40,000 beds for a population of 317 million people in this country, and not enough alternatives to long-term inpatient care.
Over the last 20 years, for example, we've seen increases in suicides, suicide attempts, homicides by people who are mentally ill, victimization of the mentally ill, jail and incarceration, and increase of substance abuse. Across the board, it's an F. It's an F, and it has to change.
Murphy says he's hoping his bipartisan bill, the Helping Families in Mental Health Crisis Act, can start to change all of that. It would do things like create more access to beds at psychiatric hospitals, combine federally funded programs so we're not wasting money and duplicating efforts, and create a new position to be called the Assistant Secretary for Mental Health. How does your background as a psychologist inform what you're trying to accomplish?
I've spent my career working these issues. I know them. I know many things have worked and some things have not, but I've also seen mental illness always pushed into the dark shadows. And what I don't want to have happen here, I don't want us to live in denial in Congress anymore.
Right now, Congressman Murphy's legislation is in committee, so it could be a while before a vote on the House floor happens. Last week, a group of Democrats introduced a competing bill with similar measures. We have a